Dual Diagnosis: Untangling the Knot of Substance Abuse and Mental Health. Imagine you're lost in a dense forest, the branches clawing at your clothes, the path obscured by tangled undergrowth. That's what it can feel like living with a dual diagnosis, where both substance abuse and mental health issues grip you in their twisted embrace. It's a double whammy, a storm that rages both inside and out. But here's the good news: you're not alone in this wilderness. Millions navigate this terrain, and there's a map to guide you out. This article is your compass, pointing towards understanding, hope, and healing for yourself or someone you love. The knot: how substance abuse and mental health intertwine. Think of it like a vicious cycle. Mental health struggles like anxiety, depression, or trauma can make someone seek solace in substances. The temporary escape can feel like a warm fire in the cold, but the high fades, leaving behind ashes of addiction and worsening mental health. It's a trap, a quicksand that sucks you deeper with every desperate attempt to climb out. Untangling the mess: diagnosis and treatment. The first step out of the woods is shining a light on the problem. A dual diagnosis requires a holistic approach, understanding both the substance abuse and the underlying mental health condition. Therapists and addiction specialists work together, weaving a treatment plan that addresses both strands of the knot. For some, it might be like meticulously pulling at the individual threads, slowly unraveling the addiction while offering support for the mental health issues. For others, it might involve severing the thickest strands of substance dependence first, creating a clearer path to address the underlying mental health concerns. Tools for the journey: effective treatments. The toolbox for battling a dual diagnosis is brimming with options. Therapy, both individual and group, helps unpack the emotional baggage and develop coping mechanisms. Medications can manage symptoms of both addiction and mental health conditions. Support groups offer a lifeline of shared experiences and encouragement. The most powerful tool is you. Your own strength, resilience, and willingness to fight are the torch that lights the way through the darkness. Remember, even the sturdiest trees started as tiny seeds, pushing through the toughest soil to reach the sun. You have that same potential within you. Facing the challenges: relapse and stigma. The road to recovery isn't always smooth. Relapses can feel like stumbling back into the dark, but they don't erase all the progress you've made. They're just bumps on the path, opportunities to learn and adjust your course. Stigma: the harsh whispers and judgmental stares, can also sting. But remember, your worth is not defined by your struggles. You are worthy of love, support, and a chance to heal. Don't let anyone dim your light. Finding a light, hope, and healing. Dual diagnosis may seem like a daunting mountain to climb, but the view from the summit is breathtaking. Recovery is possible, and the rewards are immeasurable. A life free from the grip of addiction and mental illness opens doors to joy, connection, and a fulfilling future. So, take a deep breath, fellow traveler. You have the strength within you, the support around you, and the map to guide you. Step by step, you can untangle the knot and emerge from the forest, blinking in the sunlight, ready to embrace a new beginning. Frequently asked questions: 1. What are the most common mental health conditions that co-occur with substance abuse? Anxiety, depression, trauma, and ADHD are some of the most frequent companions of addiction. 2. Can someone with a dual diagnosis recover? Absolutely. Recovery is possible with the right treatment, support, and personal determination. 3. How can I support someone with a dual diagnosis? Offer love, understanding, and encouragement. Help them access resources and treatment, and be a patient, non-judgmental listener. 4. Where can I find help for someone with a dual diagnosis? Mental health professionals, addiction specialists, and support groups can offer invaluable guidance and support. 5. What are some resources for learning more about dual diagnosis? The National Institute on Mental Health, the National Institute on Drug Abuse, and mental health advocacy organizations like National Alliance on Mental Illness provide valuable information and resources. Remember, you're not alone in this journey. Reach out for help, and together, you can find your way out of the wilderness and into the sunshine.